Today we have a very interesting case of perivascular sheathing mimicking frosted branch angiitis in a case of retained intraocular foreign body. Intraocular foreign body is an ocular emergency, presenting a case of a 50-year-old man who presented 2 days after injury to the left eye with a metallic projectile. Ultrasound and X-ray images helped in the localization. Cataractus lens was removed and 3-port pars plana vitrectomy was commenced. After sufficiently removing the dense vitreous hemorrhage, posterior vitreous detachment was induced. On further clearing the vitreous, the temporal retina revealed a frosted branch angiitis-like picture and an encapsulated foreign body in the inferotemporal retina. The extent of damage that this small foreign body has inflicted on the retina can be seen. Vitreous around the foreign body was meticulously shaved. The site of wound entry was identified in the supranasal quadrant while performing vitreous-based shaving. A laser barrage was done around the foreign body. Perfluorocarbon liquid was injected to prevent damage to the macula. The foreign body was freed from the underlying retina. Posterior capsulotomy and enlargement of the corneal wound was performed to remove the foreign body through the limbus by the handshake technique. While grasping with the McPherson, the foreign body separated from its fibrous covering. Despite the attempt to prevent it from falling, the foreign body slipped. The impact was cushioned by the PFCL bubble and the retrieval was attempted again. This time it was successfully retrieved. An IOL was placed in the sulcus and optic capture was done. Cryo was applied to the site of wound entry. PFCL was removed and air fluid exchange performed. The case was concluded with silicone oil tamponade. Vision improved from PLPR to 6/36 with complete resolution of the perivascular sheathing within 1 week of steroid therapy. Vitreous sample analysis did not yield any microorganisms. A similar case has been reported by Madan Gopalan et al., in which a metallic intraocular foreign body was associated with vascular sheathing in all quadrants of the retina. The association between frosted branch angiitis-like vasculitis and intraocular foreign body is proved by the fact that the patient did not have any history of prodromal illness or past ocular or systemic complaints, and the vasculitis resolved with the removal of the intraocular foreign body along with steroid therapy. Thus, the havoc created by the foreign body is reversed with timely intervention.